Hi, I'm Dr. van der Westhuizen. I'm an eye surgeon working in Mbombela, and today we're going to discuss flashes and floaters briefly. So here you can see what patients typically describe: little worms or little flies, bugs, bees, or little cobwebs that they see in front of their vision. This is typically what we describe as floaters. How we know they're floaters is that they move when you move your eye. So as you move, they normally float around. If you try and track one, often they move around because as you move your eye, the little floater moves around. So that's what floaters are. We're going to just discuss where they come from. Often what can be associated with these is flashing lights. So often patients will come in complaining that they saw a bit of a flashing light and then they develop floaters. And in those scenarios, we need to have a good look at the retina, and I'm going to explain why. So here's a cross-section through the eye, and you can see that the central part of the eye is actually a cavity, and it's filled with a gel, and that gel is called vitreous. And what happens over time is when you are born, you have a very firm, stiff gel that's very thick. Over time, even in your 20s and 30s, you get liquefaction of that gel material and it starts to collapse. At some point, that gel pulls away from the back of the eye. When that happens, we call it a vitreous detachment, meaning the vitreous has pulled away from the back of the eye. Now that in itself is not necessarily an issue. It's not a retinal detachment. A retinal detachment is serious, that can be sight-threatening and often may need surgical intervention to repair. But a vitreous detachment is seen as not a serious pathology and is not eye-threatening. Now, retinal detachments and posterior vitreous detachments present with the same symptoms typically: flashes and floaters. So as the vitreous detaches from the back of the eye, often you get proteins that are released in and around the vitreous. And so you typically, as you can see here on this image, you can see that there's this area of little floaters floating around. And because they're inside the eye, as you move the eye, these move around and then you are aware of them in your vision. So that's the floaters. So where do the flashing lights come from? So flashing lights come from where the vitreous is still attached to the retina and is small and is tugging or pulling on the retina slightly. As you move your eye, the gel moves with it, and as the eye comes to a stop, the gel comes to a stop abruptly. And normally in this area here where it's still attached, it tugs slightly and you see a flashing light. So a vitreous detachment can have flashing lights and floaters, and in this scenario it wouldn't need any intervention. Often floaters may be annoying, but often settle down over time. They become less noticeable, they may move out of the visual axis, and so they're not noticeable as much. So normally we treat posterior vitreous detachments conservatively without surgery, and we monitor the retina over time. But our bigger concern is if one develops a retinal tear. Here's another example of a similar image. You can see here that you've got the vitreous that's detached from the back of the eye, as we've just seen. But as the vitreous has detached here, it's still quite adherent to the retina. And as a result, as it's pulled, instead of just peeling away, it's torn a small hole in that retina, and there's now a retinal tear. That tear allows fluid from this compartment to go through that little hole underneath the retina, and then one can develop a retinal detachment. That fluid can track down and this orange layer of the retina can come away completely, and then one has a retinal detachment. And this is serious. This can be sight-threatening and often requires surgery to repair. So flashes and floaters can be both a symptom of something that's relatively benign and safe in a posterior vitreous detachment, or it can be a sign of an early retinal detachment or detachment. And so it's important to have a dilated eye exam to look at the retina, to look at the peripheral retina, make sure there's no holes, there's no tears, and there's no signs of detachment. In terms of managing these two conditions, as I said, with vitreous detachments, normally conservatively. If the floaters are large, very annoying, and the patients are very symptomatic, one can consider doing surgery to remove those. That's called a floaterectomy. If one has a retinal tear without a detachment, often in the clinic we can laser that hole to prevent it from detaching. If it has already detached, surgery is often required. So I hope that was helpful. I hope it gives you an understanding of where flashes and floaters come from. But I think it's important to note, if you develop new flashes and new floaters, to ensure you see your eye doctor for a dilated exam.